the chemistry of elements in medicine. This is the unit from organic plus inorganic chemistry paper. Okay. So we have to see what types of inorganic elements are present in human or other living system, and some elements, inorganic elements, which are used for the treatment of diseases as a medicine. Okay. Now there are a number of elements present. Yesterday we have seen there are about 30 to 35 elements are present in the living system. Some which are required in large quantities, that the carbon, hydrogen, nitrogen, oxygen, these are called as bulk elements. Some are trace elements, or that they may called as macro elements, like calcium, phosphorus, etc. And some are called as trace elements, ultra trace elements. Okay. Now those elements has a fixed concentration in the living system. So the less concentration is also harmful, that causes deficiency, and the higher concentration is also harmful. Okay. So to regulate these, we need some treatments. Okay. That we have to see now. So the first we call it as chelation therapy. Now suppose iron is required for the living system, mostly red-blooded animals. Iron is present in what we call it as hemoglobin. Iron is present in hemoglobin, and that is the responsible for carrying oxygen from lungs to muscles and carbon dioxide from muscles to lungs. Okay. Now there is some fixed concentration of this iron. If it is less, then there may be the less percentage of hemoglobin in the blood that will require to increase to the normal level. जर कमी असेल iron, then there will be the less percentage of hemoglobin, and there will be less transport of oxygen and carbon dioxide. So that should be increased. That is done by giving some iron supplements, some injections or tablets, capsules, etc., which are multivitamin, which contains the iron. Now, what happens if there is excess of iron? In some cases, lower concentration of hemoglobin is not due to lower concentration of iron. That may be due to lower formation of porphyrin rings. Because in hemoglobin there are porphyrin rings, 4 pyrrole rings. There may be less synthesis of those porphyrin rings, and because of this, the iron will be utilized less. So then excess iron will remain in the body as it is, or that cannot be stored in the ferritin. Then that excess iron is too much toxic. That iron is too much toxic. It combines with oxygen and forms some toxic substances that can be removed, that should be removed from the body. Same for calcium also. If there is a less calcium, then there may be that called it as arthritis, weak bones. If there is excess of calcium, that is called calcification. There may be excess growth of bones at some joints. So that calcium should be removed. So all elements, all metals mostly, which are present in the body at some higher concentration than the required, those elements should be removed from the body. Now, how to remove these elements from the living system? That to remove this, we use chelation therapy. Some chelating agent. We have seen what are the chelating agents, what are chelate compounds. Chelate compounds are the complex compounds in which the metal atom, metal ion is trapped between a polydentate ligand. Metal ion is trapped between the polydentate ligand. Suppose the metal, say this is the polydentate ligand, whatever it may be, suppose the oxide. Like this, the cyclic ring is formed, and that metal atom, metal ion M plus, is trapped between these ligands, that is called as chelate compounds. Now, to remove these excess elements from the living system or from the body of an animal, we have to introduce such a ligand, polydentate ligand. That polydentate ligand is called as chelating agents. Chelating agent. So that chelating agent can form complex that is called as chelate compounds with the metal ions. But it may be metal ion, it may be plutonium, it may be iron, it may be calcium, it may be lead. Okay, that can form the chelate compounds with that metal ion, and that chelate compound can be excreted through excreta, that may be urine, stool, or sweat, whatever may be, that is removed from the living system. That is called as chelation therapy. This is called as chelation therapy. The excess element is removed from the living system by forming a chelate compound. That is called chelation therapy. Now there are different chelating agents which are used to access these elements. We have to see the three chelating agents: bisphyrol, then siderophore, and siderophore 3,4,3 Limac. These are the chelating agents which are in the elements from the body. So these are the classes of these chelating agents. Okay. So bisphyrol, it has a cyclic structure. Bisphyrol has a complex cyclic structure, and they have many donor atoms. For example, if we see the structure of this one, it is somewhat complex. This is the structure of dispheroxamine. This is the structure of dispheroxamine. It has donating agent, this nitrogen, this oxygen, this nitrogen, etc., etc. So the metal is trapped between this cavity. Mostly this drug is used to remove excess of iron from the living system. This drug is used to remove excess of iron from the living system. It is given intravenously. It is given intravenously. There are 2 to 3 types of introduction of drugs in the living system, in the body: intravenously, intramuscular, orally, normally. Orally means we take oral tablets, syrups, etc. That is orally. Intramuscular means that is given in the muscles by the injections. And intravenously means that drug is introduced directly in the veins, bloodstream. That is intravenously. So this drug is given intravenously, when there is excess of iron in the body, then this can combine, this can form a chelate compounds with the iron. That iron is get trapped between these cavities, and that is removed through excreta from the living system. This we are using this chelating agent, so this is called as chelation therapy. The next class is the siderophore. This siderophore is prepared from some bacteria. These are secreted from some bacteria. This is another type of chelating agent. It has catechol units. It has catechol units for the binding to form the complex. This is also used to remove iron from the living system, excess of iron from the living system, and it is given intravenously. So it can combine with the excess of iron, free iron, and that iron can be excreted through the. And another one is siderophore limac 343. This is used to remove plutonium. If the body or the living system is exposed to the nuclear radiations, then the plutonium may be inhaled. The plutonium is toxic. Plutonium is harmful for the living system. So that can be removed. That can be removed from the body. So this can be done by using this siderophore limac drug intravenously. It is a chelating agent. It can form chelate compounds with the plutonium, and that chelate compound can be excreted from the excreta. Most common are the iron, sometimes lead poisoning, mercury poisoning, iron, calcium, etc. If these are free ions, then they are harmful. If they are combined with these free ions, cannot be removed from the living system. They combine with some other one. For example, if oxygen is there, iron is there, iron combines with oxygen and form a harmful compound. Okay. Iron oxide. If there is a calcium, excess calcium, oxalate is present in body, and that can form calcium oxalate. That calcium oxalate deposits in kidney, and there is formation of kidney stone motion. So to remove these elements, we use chelation therapy. Chelation therapy is nothing but to introduce some chelating agents in the body so that they can form chelate compounds with that elements, and those chelate compounds can be excreted from the body by the excreta. So this is the chelation therapy. Now next we have to see the elements or the inorganic compounds which are used in cancer treatment. Now, cancer is not caused by some external factors, bacteria, viruses, etc., etc. Cancer is caused by internal factors. Cancer is nothing but the abnormal growth of some cells, abnormal division of some cells, which are originally present in the living system. हे बाहेरून कुठला ऑर्गॅनिझम किंवा कुठला व्हायरस येऊन हा डिसीज कॉज करत नाही. So sometimes normal cells behave abnormally and they divide rapidly. They divide rapidly, and such cells are called as malignant cells. Such cells are called as malignant cells. Now, to treat some bacterial infection, viral infection is easy by using some antibiotics. Antibiotics kill those bacteria, those viruses, etc. Because the bacterial cell is too much different from the animal cell. When we introduce some drug, antibiotic say, that antibiotic will kill specifically that bacteria. They cannot attack, that antibiotic cannot attack on that animal cell, that attacks on the bacterial cell or virus, because their DNA and RNA, etc., is different. But in cancer, The malignant cell is originally normal cell. There is no much more difference in cancerous cell and normal cell. So we have to select a drug such that can differentiate between normal cell and malignant cell. If that cannot differentiate, then normal cells may be attacked by this drug. Chemotherapy, this is called chemotherapy. Chemotherapyचा ड्रॉबॅक होता है कि कॅन्सरस सेल सोबत नॉर्मल सेल्स सुद्धा अटॅक होतात, टार्गेट. बिकॉज अगोदर जी नॉर्मल सेल होती तीच सेल पुन्हा काय झाली, काहीतरी ॲबनॉर्मॅलिटी आली आणि तो रॅपिडली डिवाइड झाला. So there is not much more difference between normal cell and malignant cells. Generally, all antibiotics or drugs behave or combine with the RNA or DNA of a cell. That if we use antibiotics, antibacterial drug, that drug can combine with the DNA of that bacteria or RNA of that bacteria and stops its division. RNA रिप्लिकेशन किंवा डीएनए रिप्लिकेशन होते आणि त्याच्यापासून मग एक बॅक्टेरिया दुसऱ्या बॅक्टेरियामध्ये डिवाइड होतो. ठीक आहे. मग अँटीबायोटिक काय करतं, त्याच्या आरएनए सोबत किंवा डीएनए सोबत कंबाईन होतं पर्टिक्युलर साइटला. दॅट इज कॉल्ड एज बाइंडिंग साइट्स. आणि मग पुढची जी प्रोसेस आहे डीएनए सिंथेसिसची ती स्टॉप होते आणि मग तो बॅक्टेरिया पुढे ग्रोथ होत नाही त्या बॅक्टेरियाची, किंवा तो बॅक्टेरिया मरून जातो. So there is much more difference between bacterial DNA and animal DNA. So that drug antibiotic can make that differentiation. Okay. Now to kill this malignant cell also, this drug which we are going to use, that should be able to differentiate that malignant cell and normal cell. Okay. So this is the difficulty by to treat the cancer. Cancer treat करण्यामध्ये ही एक difficulty. So mostly सर्जिकल मेथड ना जेवढा पार्ट ॲबनॉर्मली ग्रोथ होतो तेवढा काढून टाकतात. पण ते काढून टाकल्याच्या नंतर सुद्धा ती ब्लड स्ट्रीम मधून सुद्धा एखादी ॲबनॉर्मल सेल दुसरीकडे गेली आणि तिथं थांबली, पुन्हा तो होऊ शकते. ओके. सो सम drugs are used to treat the cancer. Mostly we have to see the complexes of platinum. Complexes of platinum. Cisplatin first. Cisplatin. This is the complex of platinum. Next three. This complex is used to treat the cancerous cell. This when introduced in the bloodstream intravenously. When this cisplatin is introduced intravenously, then it goes to the target cell, that is the malignant cell, and it binds with the DNA of that cell, particularly at guanine N7 position. In the DNA, what is in DNA? DNA or RNA, that there are amino acids. There are amino acids. DNA and RNA are chromosomes. DNA and RNA are made up of amino acids. Isn't it? Amino acids has peptide linkage. There is nitrogen. There is nitrogen. There are 20 amino acids. 20 amino acids. That 20 amino acids are वेगवेगळे sequence का वेगवेगळे DNA बनतात. So this can form complex. This can bind with the nitrogen at N7 position of guanine. Guanine is the amino acid which is present in DNA. Okay. Now normally the DNA सोबत जो normal होता त्याच्या सोबत आता हा platinum binds. Okay. मग जे पुढच्या प्रोसेस साठी डीएनए सिंथेसिस साठी जे पाहिजे होतं ते मिळणार नाही. डीएनए इज ब्लॉक्ड बाय दिस कॉम्प्लेक्स. डीएनए इज ब्लॉक्ड बाय दिस complex cisplatin. So the DNA synthesis is stopped, cell division is stopped. Cell division stopped. So the abnormal growth of those cells were stopped by using this cisplatin drug. Cisplatin drug binds to the N7 position of guanine DNA of that malignant cell. It has capacity to differentiate normal cell DNA and malignant cell. This is most important condition for a drug to use as an anti-cancer. Okay. So we use cisplatin for the treatment of cancer. Then we use carboplatin. Another one complex of platinum. Carboplatin. In place of this chlorine, there is a carboxylic acid group. This is called as carboplatin. Mode of action is same, that platinum combines with the nitrogen of that guanine and it stops the DNA synthesis. Okay. This is another one complex of platinum which is used for the treatment of cancer. Then trinuclear platinum, that is called as satraplatin. Another one is the satraplatin. This is a trinuclear complex. This is a trinuclear complex. There are 3 platinum atoms per molecule. Platinum, Cl, NH3, NH3, NH2, then it is binded. Again, it is NH2, platinum, NH3, NH2, NH3, then again it is binded with platinum, NH2, Cl, NH3. As this contains more organic groups. This organic groups. So this is also used as an anti-cancer drug. So these are the platinum compounds which are used as an anti-cancer drug. Some other compounds or complexes of ruthenium. Complexes of ruthenium are also used as anti-cancer drug. But cobalt is not a drug. Cobalt आपण रेडिओ साठी वापरतो. Complexes of ruthenium. These ruthenium complexes are introduced in the bloodstream by using some iron binding proteins. These are not introduced directly. These are introduced with the help of some iron binding proteins, say transferrin. This transferrin and the complex, ruthenium complex, is introduced in the bloodstream and it moves to the target cell. malignant cell जवळ जाईल and the mode of action is same. It binds with the DNA. Okay. It binds with the DNA and gives false DNA synthesis. Some titanium compounds yesterday we have seen. Titanium compounds also acts as anti-cancer drugs and gallium compounds, gallium complexes. Okay. So this is regarding anti-cancer drugs. Next, we have to see anti-arthritic drugs and imaging agents. That we will see tomorrow. आपण उद्या बघू. तुम्हाला सगळ्यांना इन्व्हायरमेंटचा प्रोजेक्ट लिहून द्यायचा सांगा. कोण कोण प्रेझेंट आहेत आज त्यांनी सगळ्यांनी बाकीच्यांना सांगा. कॉलेजमध्ये प्रोजेक्ट बुक मिळते, त्या प्रोजेक्ट बुक मध्ये कुठलाही इन्व्हायरमेंटलशी रिलेटेड टॉपिक घ्यायचा आणि त्या बुक प्रोजेक्ट बुक मध्ये लिहून 27 तारखेपर्यंत देऊन टाकायचं. ओके. ठीक आहे, आपण थांबूत आज.